persuasive, inflated by the Honorable Prime Minister of India, Shri Narendra Modi ji, who has consistently emphasized Arogya Brahma Bhagyam, health as the foundation of social and economic well-being. Under his leadership, initiation into Dhanush, elimination drives for TB, malaria, and neglected tropical diseases, and strengthened preventive healthcare have reshaped India. Thank you, ma'am, for doing the honors. Very warm welcome to you, sir. A very warm welcome to you, sir. And let's put our hands together, ladies and gentlemen, today.
वर्षों से स्वास्थ्य के क्षेत्र में a happy happenstance that the Program for Advancing Public Health Forum 2025 is at the precipice of a day that celebrates good governance across the nation. I take this opportunity to pay homage to Shraddheya Atal Bihari Vajpayee ji, जिन्होंने अपने कार्यकाल और अपनी कार्यशैली से देश में सुशासन की परिभाषा को स्थापित किया। आज प्रधानमंत्री नरेंद्र भाई मोदी के नेतृत्व में देश भर में सबका साथ, सबका विकास और सबका प्रयास हमारे देश का मूल मंत्र बन चुका है। इसी संदर्भ में आज नड्डा जी का यहाँ पर उपस्थित होना इस बात का संकेत है कि गवर्नेंस और गवर्नमेंट is not functioning in isolation, as has been enunciated in the film that was presented to you on the Women's Collective Forum, that the Women's Collective Forum hopes to bring about equity through ensuring a South-led dialogue between policymakers, leaders in Indian political systems, and the private sector. As somebody who has been encouraged by the work that the Women's Collective Forum has done in the past 1 year, Nadaji, with your permission, I would like to take this particular opportunity of extending my gratitude to not only your ministry, but सभी महानुभावों का मार्गदर्शन प्राप्त करने के लिए इच्छुक हैं, लेकिन I will take this opportunity, Nadaji, under your leadership and ICMR, to extend my gratitude to the National Institute of Malaria Research, the National Institute for Research in Tuberculosis, the Vector Control Research Center, and the Indian Institute of Kharagpur for the magnanimity that the academic and for the magnificence that their own academic journey today is well established through just these 4 forum cohorts that we present, Nadaji, under your leadership. प्रधानमंत्री मोदी ने बार-बार इस बात का उल्लेख किया that affordable health not be relegated to just speeches in parliament, that affordable health becomes a reality, that health becomes central not only to government directives but also government efforts. Also desires and needs, and Ms. Bhalla, on behalf of the Women's Collective Forum, our gratitude for stepping up every time there's a call for collaboration. Dhanyawad.
Addressing the challenge of tuberculosis, which is prepared. A round of applause, please. The next report, India's progress towards eliminating lymphatic filariasis. Multi-stakeholder consultation to highlight.
It is indeed a matter of great great opportunity for me and a happy occasion. And we are here to be the part of the Advancing Public Health Outcomes Forum of 2025, along with the Women's Collective Forum and collaboration with the Gates Foundation and CII, and also with a partnership with Indian Council for Medical Research, National Institute for Malaria Research, Indian Council for Medical Research, National Institute for Tuberculosis, and Vector Control and Research Center of ICMR. I would like to first congratulate my esteemed colleague, Madam Smriti Zubin Irani ji, for organizing this program and taking the initiative and bringing various forums on one platform, and also going for a very ambitious program and helping the Government of India in the program of elimination of malaria, elimination of tuberculosis, elimination of lymphatic filariasis. First of all, thank you for your good effort. I would also like to take the name of the Center for Excellence for the Affordable Healthcare of IIT Kharagpur, and we are involved in the whole process. We have just now seen the 4 reports which have been released today on malaria, on tuberculosis, on lymphatic filariasis and immunization. I would like to share with you that under the dynamic leadership of Prime Minister Modi, the health sector has taken a long leap. And it has taken a long leap because it has been a government of the past 11 years, which is responsive government, which is responsible government, which is accountable government, and which is a government which wants to see the change in the common human life of an individual. And for that I can say that in the health sector, if you talk about, it has been a monumental leap which has taken place in the health sector as far as the technology is concerned, as far as the technology-driven facilities being provided to the individual, and the innovation. And as Dr. Valeria told, and as it was also emphasized by Dr. Behel, we believe in Jan Bhagidari. So in all these programs, the people's participation has been the center of all schemes and programs, which has brought results and which has brought a change in the whole process, or in the whole goal which we want to achieve. When I talk about India's transition, it is from the disease control to disease elimination. एक समय था जब हम भी चलते थे, मानवता भी चलती थी, बीमारी भी चलती थी, और हमारा प्रयास भी चलता था, सब साथ साथ चलते थे। अब समय बदला है, अब हम चलेंगे, मानवता चलेगी और डिजीज को हम समाप्त करेंगे इस लक्ष्य से। इसलिए इंटरसेक्टोरल हम लोगों ने आगे बढ़ाया, और इन सब चीजों को करते हुए we came out with a health policy in 2017, which when you say monumental leap, we also say about the change in the health thought process. Previously, the health thought process was curative. आप सुनते होंगे, हमारे डॉक्टर भी कहते थे कुछ भी खाओ, कुछ भी करो, एंटीबायोटिक ले लो, ये आपने सुना होगा, you must have heard. चलेगा, परहेज की कोई जरूरत नहीं, लेकिन एंटीबायोटिक ये जरूर खाओ. With all due respect to Dr. Valeria and Dr. Behel, one is a pediatrician and one is a pulmonary expert, but still, ये एक आवाज थी. 2017 में we decided that prevention and promotion of healthcare is very important part of health. So prevention, promotion, then curative, then palliative, then geriatric, हर एक की चिंता करनी है. तो holistic approach, comprehensive health approach, it came in 2017, where the prevention healthcare and promotional healthcare को हमने बहुत अहम तरीके से जोर दिया, जिसको हम आगे बढ़ाने का प्रयास किया, और उसमें हमने rehabilitative को भी जोड़ा. Abhi, when we were talking about Ayushman Arogya Mandir, now this is the first contact point where an individual gets in touch with the health institution or a health facility. And the number is 1,81,000. And our intention is that after every 2,000 or 2,500 population, there should be one Ayushman Arogya Mandir. So that, and it should have an ASHA worker, it should have a community health officer. So the first contact point, he or she should get the health facility. That is our intention. And these Ayushman Arogya Mandirs should be NQAS, National Quality Assessment Standards, which should fit. So NQAS we have covered, and I'll be happy to note that approximately 30,000 of the Ayushman Arogya Mandirs have been NQAS. They have got the NQAS certificate, National Quality Assessment Standards, that we have completed. Now, what we are trying to do is that, first of all, mother and child है, और मैं बड़े जिम्मेवारी के साथ आपको कह रहा हूँ कि आज की डेट में हमने इस बात को इंश्योर किया है कि देश में कोई भी माता जिस दिन गर्भवती होती है उस दिन से उसको हम डिजिटली ट्रैक करते हैं. The ASHA worker's responsibility is there that she should, the day a lady gets pregnant, उस दिन से हम उसको ट्रैक करते हैं. 5 essential, मैं इसलिए बात कर रहा हूँ कि ये सब चीजें ट्यूबरकुलोसिस, मलेरिया से लेकर के सारी चीजों में जो हम रोकने का प्रयास कर रहे हैं उसके एफर्ट्स कैसे चल रहे हैं. 5 essential antenatal checkups is compulsory. 1 checkup with the specialist is necessary. 8 checkups for high-risk patients and 3 checkups, along with 8 checkups, 3 checkups should be done by specialists. And all this is tracked. ये हमारे बोलने से नहीं होता है. This is all being tracked because digitally ASHA has to put into her system that Kusum Devi का first checkup हो गया है after trimester, second checkup अब होगा, third checkup कब होगा. And if the checkup is not done, digitally there is an alarm and an alert system to the patient, to the ASHA worker, to the DMO, the block medical officer, to the chief medical officer, and to the mother and the child tracking system here in India. Now you can understand how we are trying to see to it that mother and child checkups for me. I would also like to share with you that you will, वैसे कोविड में आपने काम किया तो यू नो कि और उस समय जब हम लोग 2017 to 16-17 में जब हम कोविड पे काम कर रहे थे, यानी we were trying to digitally come out with a solution so that we would track everybody. We never knew that pandemic like COVID is going to come, and it came. By that time, Government of India digitally was ready, so we had COVID. And you will be happy to note that the certificate given by America for a COVID vaccination is given on a piece of paper, and here you get the COVID vaccination certificate on your mobile. This is digital India. People did not know that they were having diabetes. So this is screening, and this is how we are trying to bring a change in the end. If you talk about cancer, 33.8 crore have been screened, and 2 lakh patients have been found to be diagnosed with cancer. So early detection is very important. If I talk about cervix cancer, 8.4 cancers ladies have been screened, and 90,000 have been diagnosed as being a patient of cervix cancer, and so early treatment has started. If I talk about breast cancer, 15.8 crore women have been screened till date, and 75,500 have been diagnosed and the treatment has started. All this I am talking to you because I want to share with you that how early detection is going to help for a healthy life. Because ये preventable है, इसको prevent किया जा सकता है if timely intervention is done. So that is how we are working. The country has come from high burden to high impact state. High burden state country to a high impact state. And the decline is in malaria, incidence is 80%, and the death decline is 78%. So you can understand that how much, and this is 2025 World Health Organization Global Report on Malaria. So you can understand that what intensive penetration the health department with public participation has been done, that we have to understand. If we talk about, it was 237 per lakh patients in 2015, now it is 187. And the decline of India incidence is 21%, and the global decline is 12%. So these are all